Hello, I'm Andrew. I'm a physicist turned biologist, and I'm broadcasting to you live from my front room because, of course, the whole UK and much of the world is locked down because of the one thing that everyone is talking about: coronavirus. And what I wanted to do was, I think there's one thing the government and the media aren't really communicating very clearly, and that's that, we're in lockdown now. Obviously, you're probably aware of that. If it's still lockdown where you are, you're watching this from your house, only allowed to leave certain times of the day for certain particular reasons. What's not really being made clear is how the situation ends. Like, how does lockdown get released, and what's the long game? What's going to happen to coronavirus over the next few months or even few years? So I wanted to make a video just to try and delve into some of that, because I've been reading an awful lot of papers, a lot of news. As a scientist, I've been having a lot of trouble even tearing myself away from the news and all the different science that's coming out around this thing, and try and delve into what's actually going to happen, what the future really holds when it comes to coronavirus. So the way this really ends, like the final end game when coronavirus is defeated, is that we get to herd immunity. Now, you might have heard that phrase being thrown around by various different politicians and journalists, so I thought I'd just explain quickly what it means. When you've got a new virus like coronavirus that enters a population, nobody has ever seen that virus before. And what that means is that there's no immunity, no natural ability to fight the virus in the population. And that's why coronavirus has been so contagious and run so rampant through all the different countries around the world that it's made it to. However, people can become immune, and there are two different ways you can become immune. You can either be infected and survive, obviously, and then your body will learn to recognize that infection, the virus, and it'll come up with its own defenses, which means that if you're infected by the virus again, your body can just bring those defenses straight to bear and hopefully wipe out the virus before you even know you're sick. And the second way you can become immune is by becoming vaccinated. So if we develop a vaccine for the coronavirus, then you could get a jab in your arm, just like the injections you have when you're a kid or when you're going traveling, or your annual flu injection. And what that does is it teaches your body, it sort of gives your body a sneak preview of what the coronavirus would look like. And then your body can build up those same defenses, which means that if you actually are infected with a real coronavirus, you're ready to fight it off. How many people in the population need to be immune to a disease to stop it from spreading depends on how contagious that disease is. And epidemiologists often try and quantify how contagious a disease is using a number called R0. You might have heard this mentioned in the media. It's the number of people that an infected person with coronavirus will go on to infect in a completely naive population that's never seen coronavirus before. So we think at the start of the outbreak, that number was somewhere between 2 and 4 people. So every infected person would go on to infect 2 to 4 others with coronavirus. But as that immunity starts to spread through the population, it might be that of those 3 people they would have infected, if 2 of them are already immune, then they'll only infect 1 person in actual fact. So as you can see, if we had about 2/3 immunity, then R0 would go from a value of 2 or 3 to maybe a value of 1. And if we can squash R0 below 1, then that means coronavirus, rather than growing exponentially in this terrifying way that we've all been observing, it would actually slowly fizzle out. So that means if you can get enough people immune in the population, either because they've been previously infected or preferably because they've received a vaccination, then coronavirus will stop spreading and we can finally get this disease under control. So that is the ultimate endgame. That's how coronavirus will hopefully finally die. One way or another, through infection or vaccination, there'll be enough people in the population immune to the disease that nobody else can catch it. There are 2 important caveats to the herd immunity idea. The first of them is that it is far preferable to get herd immunity through vaccination rather than just through getting a huge number of people infected. And the reason is that although we don't exactly know the mortality rate, so that's how likely you are to die if you contract coronavirus, we do know that it could be quite high. Estimates range anywhere between 0.1% and 1%, and those are not odds that I'd particularly like to run myself. So the problem is that if you want to infect, say, 2/3 of the British population, that's over 40 million people with coronavirus, and there's a 1% chance of death, then that's over 400,000 deaths to achieve herd immunity by this method of just infecting the population at large. And actually this very simple back of the envelope calculation tallies up quite nicely with a more formal modelling exercise, something called the Imperial model, which you might have heard people talking about a month ago. In the middle of March, Imperial College in London did this modelling exercise, and they worked out that unchecked, left a sort of rampage through the population, coronavirus would kill about 500,000 people. So clearly, you'd rather not get herd immunity through just letting people get infected, because the risk of death is just too high. Even if we realise the death rate's actually quite a bit lower, it could still be tens or hundreds of thousands of people who have to die in order to get herd immunity that way. So the ideal method would be to do it by developing a vaccine. The other quite serious caveat with any immunity-based strategy, even if you're talking about vaccinations, is that we don't know how long immunity to the coronavirus will last. This coronavirus disease is obviously completely new, so we don't have any actual data from people who were infected a year or 5 years or 10 years ago to see how long their immunity lasted. But we do have other examples of coronaviruses, other viruses in the same family that we can use to try and build up a clearer picture. There's SARS, which was a serious disease that was in the news about 20 years ago, but there's also much more common coronaviruses. A few of the viruses that cause what we call the common cold are coronaviruses. And what we know is that immunity to these viruses is often quite short-lived. It can even be only a few months or maybe a few years. So given that evidence, it's possible that if you have been infected or vaccinated against coronavirus, that protection from your immune system might not last very long. There have also been a number of other reports that you might have heard of people being reinfected with coronavirus after they've already recovered. And unfortunately, these reports are quite few in number, and it's never, so far at least, been entirely clear whether these genuinely are reinfections, so people who've got better then encountered the virus again and got sick a second time. So we need to watch this space and try and learn a bit more about how long immunity to coronavirus lasts. Because if immunity is temporary, if it only lasts years or at worst months, then we're going to have an awful lot more trouble getting this thing under control. The main problem with getting herd immunity by a vaccine, at least from where we're standing now, is that we do not have a vaccine. So there are loads and loads of scientists, researchers all around the world currently working absolutely full time trying to develop new vaccines that will be effective against this coronavirus. The problem is that developing a vaccine isn't a particularly fast process. We think that even in the most optimistic timelines, if everything works, first time, one after another, we're not going to have a vaccine ready for mass deployment for at least 12 to 18 months, maybe 2 years, maybe even longer. Unfortunately, there are a lot of things in vaccine development that you just can't speed up. And one example of that is safety testing. You need to give a decent number of people a dose of the vaccine and then check that they are safe after that dose has been given. You have to watch them, for a few months to make sure they don't have any adverse reactions. You also need to test whether or not they're actually going to avoid getting the disease. And given that coronavirus, thankfully, because of our lockdowns, is under relatively good control, someone just wandering around is relatively unlikely, vaccinated or not, to come across the coronavirus, which means that phase of testing can take a long time too. That's why it's so important that we do absolutely everything we can while those human trials are taking place to speed up vaccine development in other ways. And one of the key things that we can do is actually being handled not by the world's governments, but by Bill Gates through the Bill and Melinda Gates Foundation. The software tycoon, the founder of Microsoft, formerly the world's richest man, is thankfully ploughing some of his billions into building coronavirus vaccine factories. Now, you might think that's a bit premature because we haven't got a working vaccine yet, but it's actually very sound logic, because we could find ourselves in 6 or 12 months in a situation where we've got a vaccine candidate, it's passed all those human trials, it's safe, it's effective, but suddenly we've got the problem that we need to manufacture it at scale. We need to make tens, hundreds of millions, billions of doses of this thing. So we need to have a factory that's solved all of those problems before we start. So the idea that Bill Gates has had is that we should build those factories anyway, even if we don't know that the vaccines are going to work, because it means that once we have a working vaccine, then we can deploy that vaccine straight away. We can kick the factory into high gear, manufacturing huge numbers of doses. Not only will it have been built, but they'll have also solved any small teething problems in the manufacturing. They'll have made sure that the product they're making is safe and it'll be ready to deploy. So even though this seems like a waste of money, because say he builds 5 factories and 4 of them are never needed, a few billion apparently wasted now could save us trillions of dollars and potentially millions of lives if it speeds up vaccine development even by a week or a month. Another slightly more controversial way that we can try and speed up vaccine development is something called a human challenge trial. And the reason that's controversial is that human challenge trial is a bit of a euphemism, because what we mean by human challenge is to deliberately infect people with coronavirus. Let me try and explain how that might speed things up. Imagine you're trying to do a normal vaccine trial. What you do is you get a bunch of people and you give them your experimental vaccine, and you get another bunch of people and you don't vaccinate them to act as your control group. And then you send them out into the world to get infected. And normally what you do is you wait a period of time, you ask them back after that period of time, and you ask them, did you get infected or not? And you count them up. And if more people got infected in your control group than in the group who got the vaccine, then you know that your vaccine worked. Now, unfortunately for vaccine developers, the world is trying its absolute hardest to suppress coronavirus at the moment. Loads of countries are in lockdown. It means the chances of catching it are very low, whether you've been vaccinated or not. And so that means it's very, very hard to do one of these conventional trials. You either need to wait a very long time to get enough people in the control group infected to be sure that your vaccine was what was responsible for keeping cases low in that group, or you need to have huge numbers of people in your trial, which gets very expensive. So you either need a lot of people, which is difficult, or a lot of time, which is something we haven't got. So the way that we can speed things up is by doing a human challenge trial, because rather than waiting for enough people to get infected, you can just deliberately infect them yourself. So what you can do is, get a nasal spray, squirt a bit of coronavirus up the nose of the people who've had the vaccine and see if they develop symptoms. So what are the ethical challenges of a human challenge trial? Well, the first thing you've got to do is make absolutely sure that your participants fully understand what they're getting themselves into, because you're going to deliberately infect them with a dangerous and possibly deadly disease with a vaccine that you don't even know whether it works or not, because that is the point of the trial, right? However, once you've got over that hurdle, this actually isn't such a terrible idea. The first reason is that you can recruit people into your trial who are the safest possible people to infect with coronavirus. We already know that it seems to affect young people less. They're less likely to develop serious symptoms, they're less likely to end up in intensive care, and of course they're less likely to die. So you can pick the people in your trial, so they're between, say, the ages of 20 and 40. They're in the lowest risk groups. We also know that people are more likely to die from coronavirus if they have underlying conditions, things like diabetes and heart disease. So again, you could make sure that no one in your initial trial has any of those conditions. And then what you can do is make sure that they have the absolute best care. They have access to the best intensive care doctors, all the equipment they could possibly need in the event that they do fall sick enough to need it. And this can have a rather counterintuitive effect, because if you make sure they've definitely got access to this best possible care and they're in this correct group, ironically, they could actually be safer in your trial being deliberately infected than a member of the public just going about their business who, if the health service is overwhelmed, might not get access to that best possible care, those greatest possible machines. So you can try and make this as good as possible for your participants, to the point where it might actually even turn out better for them than just bumbling around in quarantine society hoping they don't catch the virus. It's also worth noting that although a human challenge trial does sound quite scary when you're looking at a new dangerous disease like coronavirus, actually we already do these kinds of trials for diseases like malaria, flu, typhoid and cholera. So these aren't necessarily as controversial as it sounds at first. So that's the long game. We need to develop herd immunity one way or the other, and preferably by developing a vaccine. But even if everything goes entirely to plan, even if Bill Gates' vaccine factories all work first time and we do an ethical human challenge study to identify the vaccine candidate the most quickly, it's still going to potentially be years before we have access to a vaccination that works. So what are we going to do in the intervening time? We can't just stay locked down. There are a variety of different approaches that I'd like to go through. The first of which is antiviral drugs. There are loads of trials for coronavirus drugs going on in hospitals all around the world at the moment. Drugs that are normally used for everything from HIV to malaria to loads of other conditions. And the big advantage of antiviral drugs is that if they work, we could potentially roll them out an awful lot quicker, particularly if they're repurposed existing drugs. Because if you take something like an HIV drug, we already have a really good idea of when it's safe, when it's not safe, what the potential side effects are, and that means we're much more able to quickly put them into use in hospitals and in the clinic. The problem with antiviral drugs is they're never going to make a huge dent in coronavirus. They might slightly improve the survival of people who've got the disease, or they might make the disease slightly shorter. But the problem is you can only give them to people who've tested positive or got symptoms, which means it will be too late to stop the spread. And that's the thing we really need to contain. If we can slightly improve people's chances once they've got the disease, that's great, but it's not a solution to this problem. The key to moving out of the lockdown is going to be testing and contact tracing. And that's because by doing lots and lots of testing, you can work out where the disease is in the population. And once you've identified those people who are infected, you can then do the contact tracing part. You can find those people who they've been in touch with and therefore might have been infected as well. And if you can then isolate those people away from the rest of the population, you can make sure that they don't pass the disease on. Now, at the moment, in a lot of countries in the world, that just isn't possible because we haven't got enough testing, the infection's far too widespread, so there'd be potentially millions of people who'd need contact tracing. So the only option we've got is complete lockdown. Try and encourage everybody to stay as physically far apart as possible to deny the virus those opportunities, those meetings when the virus can transmit and infect other people. But as our lockdowns start to work, slowly suppressing the number of cases, if we can ramp up our testing at the same time, we can get to a point where we've got few enough cases and enough testing and an efficient contact tracing network that we can start to control the virus. There are a few countries around the world that have shown us that this approach can work. Places like South Korea, Singapore and Taiwan, whereby extensive testing, extensive contact tracing and then isolating those people away from the rest of the population, they managed to keep the epidemic under control. So the hope is that by trying to emulate this playbook, countries that are currently in lockdown can start to slowly release it, and with lots of testing and contact tracing, maybe get to the point where the economy can start to get going again. Now, a key central plank of this is manual, very laborious contact tracing, where if someone tests positive, you literally call them up, ask them who they've been in contact with, ask them where they've been, and try and get in touch with all of those people to tell them that they might have been infected and get them to a testing centre. However, there are ways that we could try to automate this process, and one that's getting a lot of coverage at the moment is by using our mobile phones. China deployed a rather controversial app, which although it was technically optional, you were required to show it when you basically went anywhere, to public transport or into a lot of public buildings, which meant that people more or less had to have this app installed. And by some mysterious, not entirely understood process, it will give you a green or a red signal to tell you whether you are okay to travel or not. However, there are lots of countries around the world where this kind of draconian use of mobile phone data wouldn't be tolerated. So luckily, there are some ideas under development that would allow people to do contact tracing using mobile phones, but without having to have this sort of controversial black box app doing all the work. Google and Apple have actually come together to try to enable this technology. And the idea is that rather than tracking people using GPS, which would require you to know their every single movement and then compare it to everyone else and see who is in the same place at the same time, which would obviously be an absolute privacy nightmare, they're going to use Bluetooth instead. So while your phone's in your pocket, it's constantly got something called Bluetooth LE, Bluetooth Low Energy, always on. And the idea in this case is that it'll be transmitting out little keys, little randomly generated, non-identifiable strings of letters and numbers. And so say you're walking around, you go onto public transport, your phone will ping out its key to a bunch of people around you, and you'll collect the keys from all of those phones. And so each of your phones will know that they've been in proximity to one another. However, because these keys are random, they're anonymous, you're not able to work out who it is you've been in close proximity to, just the identity of this phone. And we can actually change those keys, say every 15 minutes, which means it's going to be very hard to piece together any actual identifiable information out of this. Now, the whole time you haven't got coronavirus, that data stays safely on your phone. But say you test positive and you've been wandering around all day in touch with a load of people, you're then allowed to upload a file from your phone onto a central server. And again, that file doesn't contain anything identifiable, it just contains a bunch of seemingly random keys. What that server does is sends a message out into the network and it says, has anyone ever transmitted this key from their phone? And that means that you can match up to the other people who transmitted you those messages as you wandered around during the day. And it'll then pop up a little alert on their phone saying, you've been in proximity to someone who's diagnosed positive with coronavirus, you should go and get yourself tested. Even if we combine the automated mobile phone-based method and the old-fashioned, bank of people in a call centre calling up everyone you've been in touch with, it's going to be difficult to get coronavirus under control with testing and contact tracing. This is a graph from a study about how difficult it would be to get coronavirus under control this way. And the colour scheme is pretty easy. It's that red is bad, green is good. We need to try and reduce that R0, reduce the number of people that every case of coronavirus goes on to infect to below 1. So that's why we need to be in the green area of the graph. So along the bottom of the graph, we've got the percentage success isolating cases. So that's the number of people that we can find successfully who have coronavirus. Then up the side of the graph, we've got the percentage success in quarantining their contacts. So in finding those people and making sure that they don't get in touch with anybody else in order to spread the disease potentially. Now this is already quite an optimistic graph. It assumes we can do that whole process within a day. And even then, we need to be up in the top right of the graph to be getting to the green part. That's where we're identifying most of the cases and successfully isolating most of their contacts in order to keep coronavirus under control this way. There are a few other scenarios they looked at. As you can see, if it takes us more than a day, we're basically doomed. The whole graph is red. And if we can do it in 0 days, so if we can do it instantaneously, then we do have a bit more green to play with. So if we can do this really rapidly in less than a day, then it's possible that we can use contact tracing and testing to really try and keep a lid on this thing. Though testing and contact tracing is the smart way to try and keep coronavirus under control, we also just need to bring everything that we possibly can to bear. The fact is that even once we start testing and contact tracing, we're probably going to have to maintain some degree of lockdown at first, just to sort of gently lift the restrictions and make sure the virus can't get out of control, as it has done in the past. But there are lots of other things that we can do that will slightly chip away at R0, slightly reduce the number of people who catch coronavirus from every case who's infected. One way that we could try to slightly chip away at R0 is by always wearing masks. In fact, the US has already made this recommendation. If you leave the house, you're supposed to try and wear a homemade mask. It could be anything from a bit of cotton t-shirt that you've improvised to a bandana or a scarf wrapped around you. And while this isn't as effective as the sort of proper masks, the surgical or the FFP3 or N95 masks that we hope that our healthcare workers and other key workers are using because they're so vulnerable, it's still worth using these homemade masks perhaps in order to try and slightly reduce the transmission. The big reason this is important is because we know coronavirus can be spread by people who haven't got any symptoms. And that means that if you're wearing a mask, you're protecting other people. If you're breathing out little droplets with coronavirus in, or if you're coughing a bit, then your mask will hopefully catch some or even most of those droplets and stop them getting to the people you're around. There's also obviously a bit of inbound protection as well, so if you're breathing air that contains coronavirus-y droplets, they're less likely to make it all the way to your nose and mouth where they can infect you if you're wearing a mask. Now, because these are homemade masks, and as I say, they're not as effective, they're not going to completely stop transmission. They don't make you safe when you go out of doors. And it's really important that you don't start risk compensating by, going to the supermarket more often or walking a bit closer to people. You've got to keep physically distant. You've got to try and stay at home as much as possible, for now at least. But if masks can reduce our naught, even if they just reduce it by 10 or 20%, then that gives us more room to play with. It means we can release lockdown a little bit more. Or there's perhaps not quite so much strain on our testing and contact tracing systems. So the idea of this is just to slightly reduce our naught and make it a little bit easier for all our other measures to work. As well as wearing masks, we can all do our bit to try and keep our naught as low as possible by carrying on with the good habits that we've all started to do during this lockdown. So washing your hands nice and regularly, staying at home as much as possible, even if you are technically allowed to leave the house, physically distancing, so trying to stay 2 meters or more if possible away from everybody when you do leave the house, and so on and so on. Because all of this robs the virus of every opportunity it gets to spread and means that other aspects of the lockdown will be able to be lifted that little bit more quickly. The other thing to remember is that R naught is an average. It's an average across everybody in society. And there'll be some people who will find it harder to keep their R naught nice and low. People who, for example, key workers who have to go to work, doctors, nurses, people who work in shops, they find it very hard to reduce their number of contacts during the day. Or maybe people who find staying at home harder. If you're a family with a lot of kids living in a very small flat, you might find those opportunities to go out once a day much more valuable. So if we can all just try and reduce our social contacts as much as possible, even as the lockdown lifts, it means we can give opportunities to other people who might find it harder to do so. Another thing we can try and do is increase the capacity of our hospitals, and in particular our intensive care units. Now, this is a really worthwhile and important thing to do, because if the virus does get out of control, the more capacity we have, the better we'll be able to treat large numbers of patients. But it's really important that, a bit like the antiviral drugs, this isn't really a way out of the problem. By the time you're in need of, say, a ventilator, you're already very, very sick. And even if we could mass produce these very specialist devices, you also need the staff, the trained nurses, the trained doctors to operate the machines and make sure that the other functions the patient needs are supplied safely. You also need the drugs that accompany the use of ventilators and other things that are used in intensive care. And you need the physical beds for the patients to lie in, because intensive care beds are quite specialised bits of equipment in themselves. I think it's fair to say that we can't ventilate our way out of this crisis. Although we should be ramping up production just because we should be hitting this in every way we can, ventilators alone are not a solution. If we can all do our bit to try and keep R naught nice and low, then the government can come in with testing and contact tracing and isolating those who test positive, then as the lockdown slowly starts to lift, we will be able to return to a degree of normality. But the fact is, this is a very long game we're playing with coronavirus. It's going to be months or maybe years before we finally get on top of this thing, before we can finally get out of the woods into herd immunity. However, I think it's really important that we do try to minimise our R naught, to keep that as low as possible, and add on top of that these layers of testing, contact tracing and isolation, because it's our one chance to return to some semblance of normality. And it's really important that we give it a go, even if it's not guaranteed to succeed, because the cost of not doing so is absolutely immense. If we let coronavirus get out of control, there may be so many cases that it would take an impossibly long lockdown to get things under control to the point where we could have this option available again. So while this option's on the table, we should try it. If it fails, so be it. But if we lose that option, that opportunity may not come back again if numbers get too high. If we fail to implement testing and contact tracing, then we could be stuck in this situation of continuous lockdowns for a very long time. This is the result of another modelling study, and what we're looking at here is along the bottom of the graph we've got time, and that slowly moving up and down line is the number of cases that need to be referred to intensive care. Now those grey blocks are lockdowns, and they're initiated when we exceed a certain threshold number of people in intensive care beds. And as you can see, This first graph, which shows our current effective intensive care capacity, we have a trigger when there are more than 1,000 patients in intensive care, and the lockdowns are almost continuous. We get these short breaks in between long periods of lockdown, and then as soon as the virus just starts to take off that little bit again, we're in lockdown once more. Now, there are more optimistic scenarios. If we could effectively double the number of ICU beds we have in the UK, what that would mean is that we could finally get to a point where there's more time not locked down than locked down. But even then, it's only by a bit. We're constantly in and out of lockdown, and as you can see, this graph extends well into 2021. That's why it's so important that we try and do the sort of smart way of solving this with testing and contact tracing. And if we can all do our bit to push down R naught and make that little bit easier, it's going to mean we can emerge into something more like a normal economy and more like normal life as soon as possible. Because if we don't, we're going to be constantly hokey-cokey in and out of lockdowns. It's going to be very, very challenging for all of us for a long period of time into the future. And the only way that this graph stops is when we finally reach herd immunity, whether that's through repeated bouts of infection, meaning more and more of the population is slowly infected, so we get herd immunity that way, or because we develop a vaccine, which, as we've said, could be years away. So we're clearly going to be in this coronavirus crisis for some time. At the time of recording, we here in the UK at least are going to be locked down for quite some time to come. But even as that lockdown slowly gets lifted, it's going to require a complicated combination of measures to come together in order to allow us to slowly relax those restrictions and bring the economy and broader society back to life. It's probably going to be a case of trial and error, because although we can look to countries like South Korea that seem to have things under control, we haven't seen how any country copes trying to lift lockdowns yet. So it's going to be a process of learning from our own mistakes and the mistakes of other countries, potentially going back into lockdown if things start to fail, and hoping that everything comes together and we can return to some kind of semblance of normality. Even if that's successful, we're still going to be looking over our shoulders until not only has a safe vaccine been developed, but it's been rolled out and administered to a large fraction of the population, which is potentially going to be years into the future. Coronavirus is clearly here to stay, which might sound like quite a depressing thought if you're already going a bit crazy stuck in your house. But actually, I think there are some reasons for optimism as we continue to try and grapple with this crisis. The first reason is that coronavirus isn't as deadly as it could have been. SARS, which was also caused by a coronavirus, had a mortality rate of about 10%, and there's no real biological reason why coronavirus couldn't be that deadly as well. We're just quite fortunate that this pandemic, this really contagious disease, isn't as deadly as it might have been. And what that means is that we're starting to get prepared for the next one. We are going to learn so much scientifically, socially, as governments, just looking around all the different ways different countries in the world are responding to this coronavirus crisis. And it means that we're going to be much better equipped if another pandemic appears. This is important precisely because the next one could be much more deadly than the current coronavirus. In fact, it might not even be a natural virus. As biology continues to advance, experts are increasingly worried about the idea of a genetically engineered virus that bioterrorists could unleash upon the world. And hopefully, by getting much more prepared for pandemics, by building up the science, the resilience and the other preparedness across the world for this coronavirus pandemic, we'll be much readier to deal with the far more deadly high-risk pandemics in future, which, as we can see from our response to the current crisis, has been quite a serious blind spot for governments. My final reason for optimism is even broader, and that's that I'm really hoping that as a result of this coronavirus crisis, people and governments around the world will realise the huge importance of listening to the grim predictions of experts. Because scientists and doctors have been warning about the risk of a pandemic spreading from animals to humans and then going all around the world on our increasingly interconnected transportation systems for years, for decades now, and yet governments have singularly failed to prepare nonetheless. What this shows us is how important it is to listen to those predictions, whether it's about pandemics, which I very much hope we'll address, or other broader issues, things like climate change or the risk from artificial intelligence or even asteroid strikes. Because it's only by huge preparation on the part of governments, by international collaboration, by scientific research, that we can conquer these enormous risks to our civilization. I think this coronavirus crisis is going to set back human progress by at least a year, because so much is on ice at the moment, whether it's the economy or scientific research or just tackling some of the huge problems that we face as a civilization, from poverty to climate change. But we've got to come out of this swinging. We've got to use this crisis as the paradigmatic example of why it's so vitally important to invest in science, to work together in international collaborations, and to work on prevention to stop disasters like this ever becoming disasters in the first place. I hope this video has given you a bit more of an evidence-based idea of where we are now, how things are going to happen over the next few months and maybe the next few years, and hopefully things will change for the better. But for the moment, this is a long haul for all of us. It's going to be a difficult crisis to get through. So just for now, stay safe, stay well, stay at home, and thanks for watching.